The first few people are starting to join. We'll let them start gathering on for a few minutes, and then I'll start speaking to them. All right, to folks who are just coming on, I'm just waiting for a few more people to make sure they can join. I'm James Barnes, principal of Cunha, and in a few minutes I'll work on introductions and all that. Just wait a few minutes, get everybody on. So just join and be ready to go. Okay, well, I think I'll begin now, and folks will come in as they need to. So welcome everybody to our family night on the opioid epidemic and awareness of fentanyl, another opioid drug that folks need to be aware of. I really appreciate your attending tonight. And with us tonight is, of course, I'm James Barnes, the principal of Cunha, and with us tonight is Ben Bartel, my assistant principal.
Hello, everyone.
And Janice Lee, our counselor. And I especially want to say welcome to Erin O'Connor Brown, who is Cunha's dean and teacher. And this was her idea, and who put all this together, bringing in folks from the county and from El Centro de Libertad to help put this presentation on tonight. So thank you very much, Erin, for doing that. And I also then I want to introduce Mary Fullerton, and Mary's with the San Mateo County Department of Health, Clinical Services Management with BHRS. Is that correct? Did I get all those things right?
Yes, yes.
Okay. So I'm going to turn it over to Mary to introduce her team and the other guests here, and we'll jump right into the presentation.
Fantastic. Thank you so much, Mr. Barnes and Mr. Bartel, and Erin, thank you so much for helping bring us together tonight. So we're really excited to be here, and we hope that this is the start of a conversation, and that this just kind of, starts putting some more questions out there. And so we don't have all the answers, but we want to just provide an overview of kind of what's happening with opioids, what we're seeing, and give a chance for some Q&A at the end. Okay. So again, as Mr. Barnes said, my name is Mary Fullerton. I work for San Mateo County Behavioral Health. Also a longtime Coastside resident, so familiar with the community. And I've been working for 13 years with San Mateo County, and I've been working most recently in the Drug and Alcohol Division. And the team that I manage works at the emergency department at San Mateo Medical. So we're over in San Mateo, but we have a team that's there 7 days a week, roughly 7 a.m. to 10 p.m. And we work holidays, weekends, and our focus at the emergency department is to help connect anybody who comes in with alcohol or opioid use disorder, help connect them to resources, kind of be that behavioral health counselor support in the moment, connect out of that crisis, provide some de-escalation, and start a path to recovery when it's that individual's time. So we've been doing this for several years now. We've seen quite a bit. We've learned quite a bit. We are still learning. We've been in the emergency department in this capacity for 6 years, and every day something new pops up. So what we're tracking with this opioid epidemic, it's not just something that our nation is experiencing. It's not just something that we're seeing in San Francisco or San Jose. We're seeing it here in San Mateo County. We're seeing it all up and down the peninsula, and we're definitely seeing it on the coast side. So it's really something to be aware of. I really commend the whole district and the school for, being willing to host us to come talk about this, because our team is dealing with this every day. And so we really appreciate anyone who's interested in learning about it. So what I'm going to do is I'm going to hand the presentation over to the people who are doing this work in the hospital and in our communities every day. Again, it's a very timely presentation. One of the boards that I sit on within the community, we work with the Narcotics Task Force through law enforcement, and there was a significant seizure of fentanyl pills and powder just last Thursday. And what we saw over the weekend were several overdose reports. And so thankfully those individuals survived the overdose and were connected with care, but we see these trends and we track what's happening. And it's really more important than ever to understand the scope of what's happening and how to keep our kids safe. So the people that are working to do that are people on my team, Camilo Gonzalez and Alex Perez, and they are with San Mateo County Behavioral Health. And also here locally in Half Moon Bay, Michael Wallace and Luis Valdiviez from El Centro de Libertad. So we're going to get the presentation started. I'm going to hand it over first to Alex, and she's going to take it from there.
Hang on a second, Mary.
Can
I just interrupt for just a second?
Please,
folks in the audience, there is a Q&A button at the bottom of your screen that will let you type in questions for us that we can address either both written or verbally. And just the only thing I would ask is if you have particular personal questions or want to talk about individuals or family, these could be more general questions, but we can direct any very specific questions about folks in your own family or if people you know. We'll give you some resources and links that where you can send those questions as well. So just wanted to set that up. So please feel free at any time, write your questions in the Q&A. All right, sorry, Alex, please.
Mr. Barnes.
No, super
Alex,
helpful.
sorry. Can I just translate real quickly?
Yeah, thank you.
Bienvenidos a todos. Gracias por estar aquí con nosotros esta noche. Tenemos un grupo de personas de San Mateo County Health para presentar en conjunto con el Centro de la Libertad. Si usted tiene una pregunta durante la presentación, por favor se puede usar la opción de preguntar y respuesta y podemos contestar a sus preguntas cuando sea buena en la presentación. Nuestros invitados son bilingües y vamos a presentar en español e inglés. Ok, gracias. Toca a ti, Alex.
Awesome. Thank you so much, Erin. So we can go ahead and dive into the presentation. So first, I wanted to talk a little bit more about what are opiates. So an opiate is a type of drug used to boost up pleasure and reduce pain. Opiates have been around for decades and have made technological advances in sciences due to how they help people manage pain. Opiates first started being made from an opium poppy, which is how things like codeine, morphine, and opium were created. However, in the 20th century, drug companies began experimenting and started creating synthetic or lab-made drugs, similar to those made from the opium flower, but more man-made. Thus came heroin, hydrocodone, oxycodone, and fentanyl. So overall, opiates give a person a temporary state of euphoria or high. The danger is that opiates are very effective painkillers, something that a lot of pharmaceutical companies and even providers just didn't really think about when pushing these medications out to the public in the 1980s. What was found over time is that the body starts to develop a high sense of tolerance to opiates, meaning the more an individual uses, the more they need to take to reach that same level of highness. This is what leads to physical dependence, or in this case, addiction. And this is how the opiate crisis really first began. Because of how powerful these substances are, opiates can severely affect multiple parts of the body and in dangerous levels, including mood, alertness, breathing, digestion, and blood pressure. Individually, these issues don't sound as severe, but together they can cause a lot of damage and can sometimes be deadly. Depending on where you are in this cycle, your body will respond negatively and can even shut down or can even reduce or result in death. This crisis has caused a lot of providers to be more careful when prescribing opiates, but the truth of the matter is that the level of addiction and the death rate is still very sky high. This has resulted into the biggest state of crisis since the 1980s when this first started happening. So I will now go ahead and translate in Spanish, which I will do after every slide. So primero quiero hablar sobre los opioides. Opioides son un tipo de droga que se utilizan para inducir el placer y reducir el dolor. En general, los opioides le dan a una persona un estado temporal de euforia que resulta en adicción. Lo más que una persona usa, el cuerpo comienza a desarrollar un alto sentido de tolerancia. Esto significa que la persona va a necesitar más droga para obtener la misma calidad del sentido. Debido a que estas drogas están tan poderosas, afectan al cuerpo humano en diferentes formas que pueden resultar en el overdosis. En este momento, nosotros como nación estamos en un estado de crisis de droga y es algo que está afectando a muchísima gente. So we will now go into the next slide, which is opiates today. So opiate use and addiction is not only a national issue, it's a global issue. It's an issue that has skyrocketed in America and has become very present in communities of color. Last year, for example, San Francisco lost more people to addiction than it did to COVID-19. So the issue here really is that we as Americans are prescribing too many opiates for minor and chronic pain conditions that can be helped in other ways. Many of the people who first started getting addicted to opiates were middle-aged people in the 80s who were prescribed painkillers. However, the target group now in 2021 are young people, beginning with middle schoolers. So that's roughly age 12. Truth of the matter is that kids in this generation are being introduced to opiates earlier on in life, and it can be through school, through social media like Instagram or TikTok, especially through a friend. The list kind of really just goes on. However, the difference between this generation of kids is that kids eventually move on to stronger drugs like heroin or fentanyl, which are both easier and cheaper to get, therefore involving themselves in stronger substances and just getting into this cycle really early on in life. And at the end of the day, I want to point out that kids don't need to be addicted to die of an overdose. They just need to have access to it or try it. Para darles más información de opioides, el uso de opioides no es solo un problema nacional, sino es un problema mundial. Ahorita Estados Unidos está recetando demasiados opioides para el dolor crónico. Lo que comenzó en los 80s afectando a las gentes mayores ya está afectando a los jóvenes más en el 2021. Ahorita en esta época a los jóvenes se les están introduciendo los opioides más temprano en la vida. Y la diferencia entre las generaciones es que muchos toman drogas más duros, especialmente los jóvenes de hoy. Y una pregunta es, bueno, ¿por qué está pasando esto? Y la razón es porque es más fácil y también más barato para obtener estas drogas. Pero al final, los jóvenes no tienen que ser adictos para morir de una sobredosis, nomás tienen que tener acceso a la droga. So I wanted to move on to talk a little bit more about fentanyl. So fentanyl is a manufactured opiate drug used for pain management. It was developed and intended for end-of-life pain management in cancer patients. So that really tells you just how strong, this substance is. It's extremely strong and highly addictive. It's 100 times stronger than morphine and 50 times stronger than heroin, meaning you don't need a lot of it to get high. So fentanyl can be found or obtained in multiple forms. It can be injected into the body using needles. It can be taken orally, like through a fentanyl lollipop, and also through patches that disperse fentanyl into the body. This drug can also be taken in various ways. Even touching it can cause an overdose. So that tells you a little bit more about fentanyl and how potent it can really be. So as stated, you don't need a lot of it to get high. According to research, a person could overdose with the equivalent of 2 to 3 table salt crystals of fentanyl. This is a tiny amount and it affects the body really, really quickly, almost instantly. And that's why it's so popular on the street. It relieves pain instantly and is very quick to get the job done. I also wanted to point out that most street fentanyl is tasteless, odorless, and colorless, making it nearly impossible to detect. This is a huge reason as to why there are so many accidental overdose cases. In 2017, fentanyl was detected in over 80% of opiate overdose deaths. And most recently, fentanyl was found in celebrity deaths as well, so it does not discriminate, including the deaths of Prince and even rapper Mac Miller. However, this isn't a surprise, and I'll explain a little bit why. Un tipo de droga que quiero hablar más es el fentanilo. Fentanyl es un tipo de opioide fabricado que se utiliza para el tratamiento de dolor. Es muy fuerte y demasiado adictivo. Es 100 veces más fuerte que la morfina y 50 veces más fuerte que la heroína. Hay diferentes formas de fentanyl, hay inyectables, hay pastillas, hay parches, pero algo importante es que pequeñas cantidades de esta droga afectan al cuerpo rápidamente, casi instantáneamente. Algo importante que decirles hoy es que mayoría de fentanyl que se encuentra en la calle no tiene color ni olor ni se puede probar, y haciendo eso casi imposible de detectar. En 2017 se detectó fentanilo en más de 80% de las muertes de la sobredosis de los opioides. Esto no era sorpresa y ahorita les explico una razón por qué. So we will now jump into recent trends within San Mateo County. So currently in San Mateo County, there have been batches of tainted supplies of benzos, cocaine, heroin, the list kind of goes on, meaning other drugs are being mixed in by sellers. An example of this is, for example, buying cocaine. When someone goes to buy cocaine off the street, chances are you are not receiving 100% of that substance and are receiving more substances mixed in. The main substance found within a lot of these supplies is fentanyl. What is important to note is that fentanyl is finding its ways into lots of different pills and powders. And, a question is, why is this happening? Most of the time, fentanyl is the substance mixed in or laced in with other drugs secretly to make them more powerful. Because this is a manufactured or a synthetic drug, fentanyl can be made easy, and therefore it's cheaper than other substances to put in, which is why it's so dangerous. Someone won't even know they're taking it until their body has a reaction to it. Overall, it's difficult to medically treat an overdose by a mixed substance. Doctors know how to treat an overdose of cocaine, of heroin, but these mixtures are not the same. What I like to say is a laced fentanyl substance is a lot like a chocolate chip cookie. So no two will ever have the same amount of chocolate chips. And the same thing goes with fentanyl substances. They will never have the same amount of fentanyl inside, and no two substances containing fentanyl will ever have the equal amounts. And what's important to understand is that, kids are curious and will experiment with different substances, especially the longer they've been using. Majority of the kids are trying pills right now, and that's the latest trend. But these pills could be falsely labeled and will commonly be laced with fentanyl if they're purchasing off the street. And of course, if added with marijuana or alcohol, can be even more dangerous. También les quiero dar más información en lo que está pasando ahorita en el condado de San Mateo. En el condado han encontrado drogas contaminadas con otras sustancias. La droga principal que está encontrando es el fentanilo. Ahorita el fentanyl se está encontrando mucho porque es muy barato y también fácil de obtener. Uno ni sabe si está usando fentanyl hasta que el cuerpo tenga una reacción. Al final, fentanyl son como las galletas de chocolate, ¿verdad? Nunca dos galletas tendrán la misma cantidad de chispas de chocolate. Y así es el fentanyl. Uno nunca sabe cuánto fentanyl van a tener las sustancias. Es importante saber que ahorita los niños pues son curiosos y van a experimentar con estas drogas, específicamente pastillas o tachas. Aunque estas botellas de pastillas que se compran de la calle se mirarán igual que las de la farmacia, estas pastillas pueden estar combinadas con diferentes sustancias. Y por supuesto, tomando alcohol o fumando marihuana hace la situación pues más peligrosa. And I will now pass it on over to Luis, who will explain the symptoms.
Thank you so much, Alex. So that was a kind of an overview of what opioids are, what fentanyl is, why we need to be so concerned about it, what's happening right now in our country and in our community, and kind of what it looks like. So Luis Valdivias and Michael Wallace are from El Centro de Libertad. You guys are up.
All right, thank you. So me and Michael are going to present on the signs and symptoms of use and withdrawal. Michael will take the English portion and I will take the Spanish translation of it. Hola, soy Luis Valdivias. Yo y Michael vamos a presentar en las señas y síntomas y él va a hacer la parte en inglés y yo haré la translación en español. Go ahead, Michael.
So some of the physical symptoms and signs of someone that's actually using opiates can be anything from constricted or small pupils to bloodshot eyes, drowsiness or nodding off, passing in and out, possible nausea and vomiting, slurred speech. There's a lack of coordination often where someone can't walk or keep their balance, and labored and shallow breathing. Extended use can show with weight loss or considerable unconsciousness where they're going in and out of consciousness. Behavioral signs can be anything from isolating, avoiding being around other people. You can notice that they're in a happier mood, sometimes they can experience euphoria. And there's often sudden mood swings and risky behavior. There's changes in habits and routines and often comes with financial problems. Their mood can vary, can be irritable, they can fall into a depression, have severe anxiety, exhibit anger, get severe mood swings, basically. Psychologically, you might notice paranoia, delusions, even they may have hallucinations or experience confusion.
Okay, thank you. So las señas y síntomas del uso de cuando están usando fentanilo o opioides pueden físicamente pupilas constreñidas, ojos rojos, somnolencia, cabeceos, náusea, vómitos, dificultad para hablar, falta de coordinación, dificultad para respirar, pérdida de peso o inconsciencia también. Para las señales del comportamiento, aislamiento, evicción, euforia visible, cambios de humor repentinos, comportamientos de riesgo, cambios de hábitos, rutinas y problemas financieros. Para las señales de estado ámnico, estar irritable, depresión, ansiedad y también problemas del control de ira. Psicológicamente pueden tener paranoia, delirios, alucinaciones y confusión también. Next slide, please.
So to recognize teen drug use, you may actually notice, again, some of these physical symptoms such as nosebleeds, nausea and vomiting, tremors, seizures, bloodshot eyes. Behavioral, once again, they may isolate, they may, their hygiene may change and become poor, where they may have been bathing and taking care of themselves on a regular basis prior. They may have secretive behavior, they may have withdrawn behavior, so not wanting to be with the family or friends, loss of interest in activities, and sudden changes in friends. Again, psychological, they may be more irritable than normal, may have anxiety and paranoia, sudden hyperactivity, or extreme mood swings. Common hiding places for teens may be inside books, behind posters or paintings on the wall, inside gaming console slots, or in games, tapes behind the dresser drawers, in a lipstick tube or a makeup case, and inside over-the-counter medication boxes. Drug paraphernalia can vary from having lighters, small baggies, rolling papers. They may keep straws or cut straws, spoons, aluminum foil, and they may have a different belt or use a belt where they used to wear it, and they may actually use pens or even razor blades. Common signs of addiction within teens. The National Institute on Drug Abuse has shared that 70% of teens have tried alcohol by their senior year in high school, whereas 50% have abused an illegal drug. 40% have smoked cigarettes, and 20% have used a prescription drug recreationally. Mood swings, while these are common in teens, addicts' mood swings are a little bit more intense, and they may be more quick to irritate. And again, with depression, many of the individuals can fall into a deep depression by this situation, either from the use or just from withdrawing from the substance.
Okay, thank you. Reconociendo el uso de drogas en juveniles, los síntomas del uso son igual a los que acabo de escribir en el slide pasado. Físicamente, también los del comportamiento, estado ámnico y psicológicamente. Uno de las cosas que pueden cambiar entre juveniles son el cambio de amigos. A veces eso puede ser algo notable. Áreas donde ellos esconden a veces las drogas, sería detrás de cuadros de pintura o posters, dentro de juego de videos, pegada detrás de cajoneras también con tape, dentro de maquillaje, también puede ser una de esas áreas. Cosas que pueden ser visiblemente para ver que si están usando o donde se puede encontrar, entre encendedores, bolsitas plásticas, papel de cigarrillo, popetes, cucharas, papel de aluminio también puede ser. Síntomas y que se ven entre los jóvenes, ellos también pueden estar usando, de 70% han usado alcohol, el 50% ha usado drogas ilegales, 40% han usado cigarros y 20% han usado también otras pastillas recetadas por doctor. También el comportamiento de ellos puede ser más instantáneamente cambiar cuando están más jóvenes, y también depresión puede ser algo que pasa entre los jóvenes. Next slide, please.
So withdrawal symptoms can appear with people who are addicted to fentanyl, and when they stop use quickly, they can often go into withdrawal and show symptoms, and those symptoms can actually be present within a few hours of the last time they actually used the drug. The symptoms can be anything from muscle to bone pain, diarrhea and vomiting and digestive issues, severe sleep problems, so wanting to sleep a lot but unable to, sometimes just plain not being able to sleep. They can experience cold flashes, and you can kind of notice this raised skin bumps or goosebumps, and often have uncontrollable leg movements, so shaking of the leg, feeling as if they're crawling on their own skin, and often severe cravings.
Okay. Síntomas de sobredosis. Son las personas adictas al fentanilo que dejan de usarlo pueden tener síntomas graves de abstinencia que comienzan tan pronto como unas horas después de la última vez que se tomó el medicamento. Esos síntomas pueden incluir dolor de huesos, problemas de dormir, diarrea y vómito, también problemas de no poder controlar su movimiento, y también síntomas de uso. Next slide, please.
So often when someone is using opioids, they may have a sense of intense euphoria and feel really good. Their brain is encouraged to repeat the behavior, which leads them to continue use. Misuse can show drowsiness or disorientation, so nodding off literally is like someone does when they're sitting in a chair. And they may have slurred speech or slowed movements or exaggerated movements. An overdose can present, basically what it does is suppress the neurological signals, so how the brain is communicating with itself and with the body. And a person's heart rate slows down, their breathing becomes really, really slow, and then usually will lead to stopping completely. Some of the signs of an opioid overdose is basically going to be slow or absent breathing, almost where they look like they're not breathing at all. The person cannot be woken up and will not be moving, unable to move or respond when you say their name. They may actually choke, cough, gurgle, or create like throat sounds. They often will have clammy skin, and at the onset, they can experience dizziness, disorientation, actually fall down, lose their balance. And there's often a discoloration within the lips and nails. So it completely change color a little, like get very pale. And their pupils typically get very, very, very small.
So síntomas de una sobredosis. So puede ser euforia intensa, somnolencia y desorientación, hablado arrastrado o movimientos lentos. Las opioides suprimen las señales neurológicas, la frecuencia cardíaca que una persona se ralentiza, la respiración devuelve peligrosamente lenta y luego se detiene por completo. Poder ser un ataque del corazón también. Señas de una sobredosis de opioid. Puede ser que no los puedan despertar. También puede ser en su respiración que ha cambiado, que esté extremadamente baja. Pueden también hacer señales como si estuvieran roncando o no poder respirar. También señales de tener como escalofríos en la piel o estar fríos ellos mismos. También descoloración, si pierden color en la piel o en los labios es cuando se nota más. Y las pupilas de ellos también pueden reducirse en el tamaño. Y si una de esas cosas pasan, pueden llamar al 911 inmediatamente. Next slide.
So if someone is actually overdosing with an opioid, NARC can be used to actually reverse the effects and kind of pull them out of it. They will often be very grumpy and agitated if we do use Narcan, but it can save their lives. Signs of an overdose can vary, but the person won't be able to be woken up. They may be snoring or again, making throat and nose sounds. Their fingernails and lips may turn blue or purple, and their skin may become very pale. They may have really slow breathing, or they may stop breathing altogether. Their pupils become very small and roll back into the backside of their head, and their body is very limp. One of the things that we can do is, if we do use Narcan, the first step you really want to do is to shake and shout at them, shout their name, shake their shoulders, tap them. Step 2 is to call 911 if the person is actually unresponsive so that you can get help as soon as possible. Step 3, use naloxone and Narcan, one spray into the nostril or inject a viral needle into the arm or leg. Step 4 would be to perform rescue breathing and or chest compressions. And step 5, if it isn't working, basically this comes down to see if there's no improvement after 2 to 3 minutes. Repeat steps 3 and 4 and stay with them until help actually arrives so they can take over for you and try to resuscitate the person.
Okay. So, en caso de una sobredosis del fentanilo, de opioides, lo que pueden usar es el medicamento de Narcan. Este medicamento se puede encontrar en el área de San Mateo County. Nosotros en el centro tenemos y en otras áreas que vamos a describir dónde pueden obtener esto. Si usted o un familiar o hijo o hija puede ocupar esto para poder dárselos. Son 5 pasos para responder a una sobredosis de opioides. El primer paso sería gritar su nombre y también moverle los hombros para ver si están respondiendo. El segundo paso, llamar al 911. El tercer paso sería darles el spray de Narcan. Si no sirve eso, entonces empiezan a hacer respiración de boca a boca o compresiones. Y si no ven que han resultado o no miran que están mejor después de 2 o 3 minutos, pueden repetir los pasos de 3 a 4. Estos también la tenemos en español, so podemos darle esto. Y también cuando vienen a lugares a recoger este medicamento, también nosotros le podemos enseñar allí mismo cómo se usa.
Great. Thank you both so much.
Thank you.
So now we're going to switch over to Camilo Gonzalez, who's going to talk a little bit about what you can do if you know someone who needs help.
Okay. Can you hear me? Bueno, mi nombre es Camilo. Voy a hablar acerca de qué hacer cuando saben alguien conozca ayuda. So I'm going to talk about what to do if you know someone that might need help. And I'll go over the slides in English first, and then I'll translate into Spanish. Next slide, please. So what to do if you know someone that needs help? First thing you want to do is be able to talk about it. If you suspect that one of your children, youth, or anyone in your family may be using fentanyl or other opiates, you want to be able to keep an open mind and talk about it. The more you're informed about it, the better it is the way that you could help. Know the symptoms of withdrawal. As they mentioned earlier, they went over the signs, what to look for when somebody's withdrawing from opiates. Be part of the solution and offer to find help. So don't just blame somebody or accuse somebody of using, but actually have a dialogue about it and come up with a solution and talk about resources in the community, or even be with them when they're asking for support, help them link to the right support system for them. Find a program that's right for them. So figure out if what they need is medical help at the moment, if they're actively using. If they're withdrawing, you want to make sure that they get the professional help they need. And if you have a naloxone on hand, you can also teach them how to use it also. Many of our clients have naloxone that they carry with them and have their family know how to use it in case they accidentally overdose. So parte de lo que yo estoy hablando es de cómo apoyar a alguien que uno quiere, como un hijo, hija o un familiar. So estar disponible a hablar del uso de drogas con ellos, mantener la mente abierta acerca de los usos, por si ellos vienen con ustedes a hacerles saber que están usando algo. Informarse más. So entre más uno sabe, mejor le puede ayudar a la gente, a sus amistades o a los hijos de usted. Saber los síntomas de withdrawal, que son cuando uno tiene el bajón o señas de abstinencia que uno no ha usado. Saber eso y saber cómo ayudar depende de esos síntomas. Ser parte de la solución y ofrecer ayuda. No solamente acusar a alguien que están usando, pero deber sentarse con su hijo, hija o familia y hablar del uso y ofrecer ayuda para buscar recursos en la comunidad y buscar servicios que les ayuden a ellos. Por ejemplo, si están enseñando síntomas de abstinencia, tal vez podrían ir al hospital o buscar un programa. Y si tienen un naloxone, un spray de nariz de naloxone, enseñarse cómo usarlo y enseñarle al familiar cómo usarlo también. Y a otra gente con que ellos usan también que lo pueden saber cómo usar, que les puede salvar la vida. Next, we have 7 tips on talking to youth or kids about drugs. So number 1, avoid blaming, shaming, and lecturing. So when somebody is actively using and you're trying to help, they don't want to hear, or it's not as effective to start blaming or accusing or shaming of why are you using? Why can't you stop? That doesn't help the situation. Keeping an open mind and keeping a dialogue is what's going to help somebody get to where we need to so that they can begin the process of wanting to change and being open to it. Number 2, speak with care and concern, not suspicious and blame. So como like I said, is not blaming them for using, not speaking in judgmental language helps. Acknowledge the autonomy. So just having them understand that it's their choice, but they can also receive the help they need and be part of that with them and help them out. Invite them to share their experience because every person experiences their addiction differently. A way to help is to talk about their experience. What is their experience with the drug use? Because there's so much behind it that may not be known, and that could help you better support. Share your concerns in concrete and non-blaming terms. Again, we're going back to non-blaming, right? So part of it is at that moment, if the goal is to help and support, blaming is counterproductive. Commit to understanding their perspective and supporting their well-being. So once we find out, or you have a discussion about drug use, is being supportive of the well-being. It's about that individual's overall well-being, not using because it could be deadly, and is showing and talking about possible negative physical side effects and how it affects them, and hoping that they get encouraged to want to move in the direction of trying to reach abstinence, and explore what would or would not be welcome now. So that's mainly just talking about what could be welcomed in the household, setting up rules, but having that concern as a parent, and non-judgmental, right? So talking about it and being able to set ground rules, and that way it could be the best supportive atmosphere that you can have. So hay 7 cosas que uno puede hacer para apoyar a sus hijos acerca de las drogas. La 1 es no tratar de acusar y avergonzar y dar lecturas acerca del uso de drogas. O si uno como padre sabe que o investiga que su hijo, hija o familiar está usando, en ese momento no es productivo acusar a la persona o hacerlo sentir mal por el uso de las drogas, o darles una lectura de por qué es malo y por qué no lo tienen que hacer. Número 2 es hablar como que usted tiene el corazón para ayudarles. No estar muy sospechosamente tratando de acusarlos del uso de drogas. Número 3 es dejarles saber que ellos tienen su derecho físico y en lo que hacen, darles el poder de que ellos tienen la decisión de mejorarse y lo pueden hacer. Número 4 es invitarlos a que compartan su experiencia. Mucha gente que usa drogas experiencia el uso de drogas muy diferente, y es importante saber cómo ellos qué experiencia tienen con el uso de droga para poder ayudarles mejor. Número 5 es demuéstrale que tienes concierno con su uso de drogas y no acusar. En ese momento no es productivo, como dije otra vez, acusar y hablar de por qué no dejan, y es mejor hablar productivamente de qué se puede hacer para apoyarles. Número 6 es tratar de entender su perspectiva de ellos y hacerles saber que lo que les importa a ustedes es que ellos estén bien físicamente y que estén sanos en ese momento, ¿verdad? El número 7 es explorar lo que se puede hacer o lo que no se puede hacer, como poner reglas básicas en la casa, pero también teniendo en mente de que los jóvenes hacen muchas cosas que uno no sabe, pero también tener reglas que ellos pueden seguir durante el tiempo que ustedes estén con ustedes. Y hay diferentes tipos de ayuda que uno puede conseguir. In this slide, we're going to talk about some recovery treatments. Sorry. There are different types of treatments for opiate addiction and different addictions. For long-term success, empowering a person to choose what works is the best for them. So what this basically means is that you want to try to empower your youth or your family who is actively using to feel like they can do it. If they want to stop, if they want to cut back, if they want to change their relationship to the substance, they can do it with the right support, which goes to the next point. A strong support network equals meaningful change. So as they say, right, it takes a village. It's the same thing when it comes to addiction, because it affects the whole individual, physically, mentally, emotionally. The more support they have, the better chances there are that they're going to achieve long-term sobriety. Treatment and recovery is that it's that person's responsibility. So, but they do not have to go through by themselves or alone. So many people, try to get abstinence or reach a point where they're not using on their own, but there's different types of journeys that they have to go through, and having the support system with them, having parents, having a community who wants them to do better is very helpful. And you'll see that there's different levels or different types of treatment. We have hospital-based programs. We have MAT programs, which is medication-assisted treatment, like the program that we have. Residential treatment, which is where people may live in a facility and do treatment there. Professional counseling could be such as therapy, counseling of that sort. Peer groups could be outpatient groups, and other support systems or other support groups within the community. So la forma de tratamiento de recuperación hay diferentes maneras. Para llegar a un largo plazo de abstinencia, se necesita que la persona tenga poder y sepa que ellos lo pueden hacer solos. So, la persona que está usando tiene que ser empoderada por la comunidad, por su familia, y hacerles saber de que ellos pueden lograr dejar de usar las sustancias solos. El grupo de apoyo de la comunidad y familiar es muy importante porque eso es lo que va a resultar en cambios que valgan la pena. El tratamiento y la recuperación es la responsabilidad de esa persona, pero no tiene que ser solo para ellos. Como dije, toma el apoyo de la comunidad, de la familia y de amistades que puedan ayudar a esa persona para poder dejar de usar. Y hay diferentes niveles de tratamiento en nuestra comunidad, como tratamiento basado en hospitales, asistencia de tratamiento con medicamento, programas residenciales que pueden ser donde alguien se interna para agarrar ayuda durante ese tiempo que están ahí, ayuda profesional de consejería como un terapista, psiquiatra, o apoyo de grupos, como puede ser grupos de outpatient, de programas, o puede ser diferentes grupos sociales que pueden haber en diferentes áreas. Y these are some examples of harm reduction methods. There's needle and syringe programs, medication-assisted treatment, HIV testing and counseling, condom programs, sexual and reproductive health services, outreach and education, overdose management, such as naloxone, psychosocial support, livelihood development. So estos son unos ejemplos de cómo reducir los riesgos de ciertas cosas. Por ejemplo, el programas de jeringas, programas de asistencia médica, de tratamiento con medicinas, exámenes de HIV y consejería, programas de dar condones, servicios de sexualidad y reproducción, educación y más conocimiento a la comunidad. Naloxone, que es el spray que se usa en la nariz para cuando la gente está sobredosis de los opios. Apoyo psicosocial y herramientas de desarrollo de la vida.
Thanks, Camilo, Alex, and Luis, and Michael. So we want to also to be able to give you some resources about not just what it is, what's the scope of the problem, what are we seeing, what does it look like when someone's using, when they're, kind of in that addiction, when they're overdosing, withdrawing, what to do, and how to help. We also wanted to provide you with some concrete resources. And so we're going to share a couple slides here on that. And I'll invite the panelists to jump in too. So if there's something I'm missing or something you want to add, please do. But wanted just to start that first and foremost, the key resource to help keep our kids safe and our community, prevent this from further, escalating in our community is really you. So there's a lot of evidence that looks at how a caring adult, that can be a coach, it can be a teacher, it can be a neighbor, and it can be a parent or a caregiver, a grandparent, aunt, and uncle, And really, when kids have that caregiver involvement, it's a huge protective factor, even if there is existing substance use in intergenerational patterns. So if there is a hereditary pattern of substance use, it doesn't mean that a kid is going to follow the same path. When they have these protective factors, first and foremost being caring adult relationships, it helps them develop healthy self-esteem, coping skills, being able to make healthy choices, and form positive peer relationships. Next, we also wanted to give you, because we know, like Alex mentioned, that pills are really a very popular form of how kids get into substance use these days. I mean, smoking marijuana is less and less. Kids that tend to like edibles a bit more. It's easier to mask. You don't, hurt your lungs, amongst other things. But we do see a fair number of pills come through, especially with youth. And so what do you do with old medication? If you had some surgery or a tooth pulled, or you have medication that you need to dispose of, it's one of the first places kids will go look is your medicine cabinet or a friend's parents' medicine cabinet. So keeping that safe and locked up is really important. And there's resources right here in Half Moon Bay, Moss Beach, the sheriff's station, where you can dispose of that safely. So this slide, we're going to make these slides available, but this slide just gives you a tip on what's accepted, what's not accepted, and how you can safely dispose of that medication. And then lastly, this is just how you reach us. And so again, Camilo and Alex are part of my team. We work at the San Mateo Medical Emergency Department. We're there 7 days a week, roughly 7 a.m. to 10 p.m. And we are there to, work with anybody who is intoxicated with alcohol or opioids or needs help with alcohol or opioids. So feel free to give us a call. And I'll let Luis and Michael talk about their services at El Centro.
Thank you. Yeah, so same thing for us. We're located in Half Moon Bay. We provide the outpatient treatment portion of getting help. We're also starting the intensive outpatient for those that may need a bit of a higher level of care with more hours in treatment or more days into treatment as well. And we help both youth and adults in our program. We do have a program in Redwood City too. So we're covered on both sides of the hill there for that. Para los que hablan español, mi nombre es Luis Valdivia, soy el director de programas del Centro de Libertad y tenemos un programa que está localizado en Half Moon Bay. Estamos en la 225 South Cabrillo Highway y la suite 114B. Y lo que hacemos en el programa es dar servicios de consejería para adultos y para jóvenes, o depende de lo que estén usando, si es alcohol o drogas, podemos ayudarles ya sea en la oficina, o también podemos salir a su casa o un lugar que sea más confortable para usted y para su familia, para poder ver si el programa de nosotros es algo que ocupan ustedes o sus niños.
Camilo or Alex, I'll put you on the spot for the translation about IMAT and what we do at the hospital.
If we can go back to the other slide, we can let people know how to dispose safely of medication. So, parte de lo que dijo Alex, como dijo ella, que muchas adicciones a los opios empiezan en casa de uno o en casa de otra gente, cuando la gente no se deshace de medicamentos, narcóticos apropiadamente. Aquí, en esta presentación que veo ahorita enfrente de usted, hay diferentes lugares donde usted puede deshacerse seguramente de cualquier medicamento que usted tenga que son narcóticos. Por ejemplo, si algún día le sacaron una muela o tuvo operación y le dieron algo para el dolor después, en vez de tener esos medicamentos en su casa, se puede, si ya no los usa, mejor deshacerse de ellos seguramente al llevarlos a estos lugares que están aquí. Esta presentación se va a dar también a ustedes para que tengan esta información a la mano. And then I can talk a little bit about our services. So as part of the IMAT team, part of what we do is our goal is to engage with individuals who want to change their relationship to alcohol or opiates. There's several case managers that work throughout the county. There's some that are embedded in the emergency medical in San Mateo Medical Center who are based out of there. There's myself and my colleague Gabriel, who are community-based. We work with programs, other community resources or community providers, And we also work with our incarcerated population, helping those individuals that are in custody who may be in need of medication-assisted treatment and may need coordination to those services when they get released. We provide case management and linkage to medication-assisted treatment. Nosotros como trabajadores de casos para el programa de medicamentos, proveemos servicios, tenemos diferentes consejeros, manejadores de casos en diferentes áreas. Tenemos unos que son basados en el Hospital General de San Mateo, que trabajan solamente con pacientes que llegan ahí con historial de uso de alcohol y opios. Otros como yo y mi compañero Gabriel trabajamos en la comunidad, trabajamos con gente que son referidas con nosotros de programas, diferentes agencias de la comunidad, y también trabajamos con gente que está en la cárcel, que está encarcelada y que tiene historial de uso de alcohol y opios. A esa gente lo vamos a ver y tratamos de conectarlos con servicios de medicamentos cuando salen de la cárcel para que puedan llegar a los servicios que de veras necesitan. Did I miss anything, Alex?
Y así como dijo Camilo, nosotros nos enfocamos en trabajar con las gentes que quieren cambiar la relación con el alcohol o con la droga. Y estamos adentro del hospital desde las 7 de la mañana hasta las 10 de la noche por cualquier pregunta que ustedes tengan. Ahí pueden localizarnos y también pueden llamar ese número que está en la pantalla, las 650-573-2735. Lo que nosotros principalmente lo que hacemos es los conectamos a una clínica aquí en San Mateo que les puede ayudar con ese aspecto, con el aspecto de la medicina, pero también la diferencia entre el programa de nosotros es nosotros también le damos consejerías como trabajadores de caso. Entonces, cualquier pregunta que ustedes tengan, favor de llamarnos a ese número y estamos a sus servicios.
English?
Thank you both so much. So at this point, do we want to go into the Q&A and invite people to add more questions, Aaron? I know there was a question in Spanish that was answered in Spanish. I wonder if we want to also answer it in English, and then a question in English that maybe we want to answer and have translated both.
That sounds great. Yeah.
Alex, since you responded to the question in Espanol, would you like to read it and then we can talk about it in Spanish and English?
Awesome, will do. So somebody asked if those patches of fentanyl that were shown on the screen, are they the same thing as Icy Hot? And if they are able to be found easily, and if they're able to obtain it easily through like a pharmacy or through another source. And so the answer to that question is fentanyl patches can only be prescribed by a doctor. And so sometimes for example, you can find fentanyl patches out on the street, which is what we showed on screen. And so that's what makes them dangerous, correct? So it's completely different from Icy Hot, very different medicine. Although they may look the same, the effect is very different.
Yeah, and I just add, very often a medical provider has to apply it to an individual. So they may be going to see their medical provider and they're applying it. There's been stricter laws around that in recent years, but there are those scary cases of kids finding discarded patches in the trash and chewing on it or finding something. I know that veterinarian clinics are also, they use fentanyl a lot for surgeries for animals because it hits your bloodstream really quickly and it also leaves quickly. And so that's another concern with veterinarian medicine as well. The next question was actually about who or where do you get help to explain addiction to children when the parents are the ones with addiction? And Luis and Michael, I'm wondering if you want to talk about that from El Centro's standpoint and what you might offer kids and families around that when parents are the ones with addiction.
Sure, Michael, I'll put you on the spot. Go ahead and answer that and I'll translate.
So we do have a prevention education plan and we do go into some schools and administer that and kind of work with the kids. But often when we get clients that come in, we talk, one of the biggest focuses is actually on family members that are using and, you know, signs and symptoms, and also just how they can get help, whether it be counseling through us or making a referral out for counseling or therapy, things of that nature. In some cases, CPS cases. But really, we try to be present and patient with the person and be able to answer their questions as fully as possible, and then offer resources and referrals.
So lo que hacemos nosotros también hacemos educación de prevención de alcohol y drogas en las escuelas. So muchas de las veces los niños también ahí podemos comunicarnos con ellos. Aparte de eso, si tienen padres que ocupan ayuda o que están en tratamiento, nosotros también los traemos al programa y también incluimos a toda la familia para poder explicarle cómo trabaja el alcohol y las drogas, para poder darles poquita más explicación a la familia, para que ellos también sepan cómo apoyar a su familiar que está pasando por un tiempo que estén usando alcohol y drogas.
Thank you both. Yeah, and I would also add, if you're a concerned adult thinking of another concerned adult, you can always call us at that 573-2735 phone number for consultation. You know, we do work with adults. Our clinic does serve young folks too. So we've served folks who are 15, 16, 17, again, primarily for alcohol and opioid use disorders, since that's the volume of what we're seeing. But we're happy to provide, if resources are needed outside of Half Moon Bay or outside of the coast, we're happy to provide those resources too. As Camilo mentioned, there's many different levels of treatment, from, you know, outpatient counseling, going to work with a therapist or psychiatrist, to hospital-based programs, residential programs. There's all different levels of treatment, and it can be super confusing. Again, you know, several have been in this field for 15 years and we're still navigating that landscape. So let us do some of that work for you. If you have questions, feel free to give us a call, and we're there 7 days a week.
And then, let me just mention also that many of our clients have attempted to stop on their own, but because our system of care sometimes may be very complex, it's very hard for them to get to the right door or the right place to get the appropriate help. So as case managers, what we try to do is we try to reduce all the barriers along the way that we can to make it easier for them to get connected and hopefully achieve long-term sobriety. So nosotros como trabajadores de casos también lo que hacemos es ayudamos a la gente, porque mucha gente que ha usado drogas ha tratado de dejar de usar por ellos mismos muchas veces, pero se pierden en nuestro sistema porque es muy confuso. So, como trabajadores de casos, nosotros tratamos de quitar las barreras que salen en el camino para asegurarnos de que ellos lleguen al lugar correcto y apropiado para ellos, donde puedan agarrar la ayuda correcta para ellos. Gracias.
Thank you. Thank you. I'm seeing another question. If it's okay to go on to the next question, I'll read it in English, and perhaps someone could read it in Spanish after I do an initial response. It says, this might be a naive question because my 14, 11-year-olds right now are bookworms, and they're at home a lot, and I know they're friends. How widespread is drug use in our town among kids? Are a lot of kids doing it? So great question. We all want to know and congratulate you on raising bookworms. I'm sure the teachers are thrilled to hear that. So how widespread is it? I mean, that's, you know, if we could accurately calculate, you know, it would be kind of a miracle. The reality is we're seeing it enough that we're here tonight. And as Alex pointed out, in what is fentanyl, you know, it's, again, we really try not to use shaming or scare tactics, because if anything about the war on drugs and Nancy Reagan's Just Say No taught us, that kind of messaging is not helpful. And in fact, didn't attract more kids to stay away from substances. It piqued curiosity because kids are curious and want to experiment and learn. And so, you know, the thing to be concerned about and the thing to know is that if they're experimenting and if they try a pill, that pill could have been purchased on the street. It could be a counterfeit pill. It could have fentanyl. And so we just need to know that, because if kids are experimenting, you know, we need to know the risks. And right now, what we're seeing in our community is significant. We have had overdose deaths on the coast side. We are treating a fair number of clients from the coast side with my team, Camilo and Alex. Camilo's been out here several times working with different families, primarily young adults. But again, that exposure and that use starts somewhere. And I can't emphasize enough the importance of that relationship, the caregiver relationship. So when they're at a party or when they're seeing their friends or when they hear of something, that they're talking to you about it and that you're informed. That's really, really important. Alex or Camilo, you want to take that?
Sure. So, alguien nos preguntó una pregunta que ellos tienen unos niños de 14 y 11 años que ahorita lean mucho y están mucho en la casa. Y esa persona sabe con quién andan y sus amigos. Ahorita la pregunta es, ¿qué son los rates de la droga que están usando los niños y cuánto están tomando los niños ahorita? Y la pregunta y la respuesta, sobre eso es que ahorita estamos viendo suficientes aquí como en el condado, que es un problema. La cosa es que si los niños están usando, tenemos que saber que hay riesgos de la mezcla de las sustancias que están usando. Hay mucho movimiento de esta droga ahorita. Camilo y yo estamos adentro de la emergencia de el Hospital de San Mateo y estamos viendo mucho mezcla de droga ahorita, específicamente con el fentanilo. Entonces es algo que nosotros ahorita pues nos estamos enfocando y nomás estamos educándolos de lo que puede pasar y nomás decirles que tener cuidado en lo que hagan sus hijos y nomás tener conversaciones con ellos. Gracias.
Thank you.
So we'll take another minute if there's other questions out there. Esperamos unos minutos más. Si hay cualquier otra pregunta, es el tiempo para preguntarlo. If you have a question, now is your time to ask it. We'll give you a minute.
Just while we're waiting for any last questions, I just wanted to say also, if you don't have any of these numbers or contact information and you have questions or problems, you can always bring those to us at CUNA, to administration or to any of the counselors. Our response to a problem like this with a student or anything else is not to get them in trouble, but to make sure that you are connected with resources that you need to help out the problem. So that's our attitude. And of course, we're in contact with all the people who've been here tonight. So feel free and safe to contact us if you're needing assistance as well. Aaron, I don't know if you want to translate what I just said, if you remember what I just spoke of. Yeah.
Yes, I can. Thank you. Hablo por el señor Barnes y nos dijo que si usted no tiene estos números o esas diapositivas disponibles para usted y necesita ayuda, estamos aquí en la Escuela CUNA para apoyarles. Solo ustedes necesitan conectar con nosotros y podemos darles los números o servicios que necesita. Nuestro deseo como escuela es para apoyar a las familias y no castigar o poner el alumno en problemas. Estamos aquí para ayudar. Entonces, si ustedes necesitan cualquier cosa, por favor, comunica con nosotros.
Thank you. And there's two more questions in the chat. And Aaron and Mr. Barnes, maybe I'll let you take the first one about what you're seeing or a drug problem in elementary schools on the coast, which is not something we're very familiar with. I don't know if Luis or Michael or anyone on the panel has heard of that.
I mean, just from my experience, I mean, I've been in the secondary schools, in the middle and the high school, but I do know that kids in the elementary schools are often exposed to what their older siblings are doing and are part of the community, and they see what's going on, and it begins to familiarize them with the use of drugs or alcohol if their older siblings are doing it, and so on and so forth. So if they see vaping happen or other types of drug use and so on. One of the things I always say to parents too, like the idea, is there a drug problem in the elementary schools? The schools are, you hear about drugs in schools because that's where kids get caught. So we'll catch a kid vaping, we'll catch a kid with stuff, and then they get in trouble or they get diverted to counseling or whatever it is. But the use is happening everywhere in the community. It could be at home, it could be with their friends outside, everywhere. So just to think about that, the schools are actually a relatively safe place in that we have eyes and ears on them a lot of the time, and oftentimes are aware when a student gets into drug use. But I'll pass that on to anybody else who wants to say anything to it. Maybe Aaron, and we can answer it in Spanish as well.
La pregunta era si hay problemas con las drogas en las escuelas primarias. Y la respuesta del señor Barnes es que los estudiantes tienen acceso o se ve lo que sus hermanos, sus familiares se usa y se participa. También le dice que honestamente nosotros como oímos de los problemas y encontramos el acceso de los alumnos en las escuelas, pero muchas veces lo que está pasando es que están experimentando con cosas fuera de la escuela y oímos dentro de la escuela. Camilo o Alex, si tiene algo para añadir o está bien.
Gracias, está bien.
Ok, gracias.
I can take the next question.
Thank you, Luis.
Los cigarros electrónicos uso de vapear también los utilizan para usar el fentanilo o cualquier otra droga. So lo que hemos notado nosotros cuando estamos en las escuelas es que los cigarros electrónicos que usan para hacer vaping, muchas veces sí lo incluyen para usar marihuana, que es el wax. Es una forma de líquido que sí les ponen a veces, que es el THC de la marihuana. Pero aparte de eso, no hemos notado ni escuchado nosotros mucho de cigarros electrónicos que estén usando para usar el fentanilo. Pero también es algo que pueden estar observadamente fijándose, porque el fentanilo se puede usar de cualquier manera. Entonces, como describimos los síntomas y en otras maneras que se puede usar esa droga, también mirar eso allí. I'll say it in English. So the question was if the electronic cigarettes that are used to vape are used to use fentanyl or any other drugs. And from our experience, from what we've seen at the schools, it's usually used more for THC consumption, the wax that they use in marijuana, but not too much on the fentanyl side of things yet. But something just to be observant about, because as we know, fentanyl can be taken various forms, so it's not out of the question that it can be used in that sense.
I have known to have had clients too where they use somebody else's vape and it's laced with other substances. So I think that's the danger of sharing vapes, is that you don't know how creative the other individual's getting to sneak the substances into their body and hide them away from people. So part of it is just being aware of sharing and safety, that if they're smoking from somebody else's vape, they don't really know 100% what they're consuming. So parte de lo que yo he visto con mis clientes en el pasado también es de que a veces ellos comparten su máquina de vape y piensan que solo están usando una sustancia, pero las amistades pueden mezclarla con otras cosas, y ahí es donde están los riesgos de que si están compartiendo sus vape machines y no saben lo que la otra persona tiene. Gracias.
Oh, I'm just checking to see if we have any more questions. It doesn't look like there are any more. Do you want to do any last words from anybody on the panel before we close for tonight?
I just want to thank everyone for their time. And again, we are really hoping this is the start of a conversation and a relationship. I'm so impressed with how easily people flowed in and out of doing this online by Zoom with sharing information and translation. And so, you know, these things are easier in person and we're going to get there very soon. So we do hope that you're seeing our faces in the classrooms and in community centers so that we can be of assistance to you all. So thank you all for your time.
And from our side, gracias a todos por estar aquí con nosotros y por su cooperación. Y sé que es algo nuevo y ojalá que podemos estar aquí para nuestras familias y nuestros alumnos y para apoyar la comunidad. So just from the school side, we were really thankful for our partners tonight in presenting their expertise to our students and our families. And like Mary said, we're really hoping this is the beginning of a partnership so that we can support our families and communities as we move forward. So thank you. And thank you all of you for taking the time to be here with us tonight.
Yes, thank you everybody on the panel. We really appreciate it. Thank you everybody in the audience who came tonight. And this will be posted on our website once the recording is made. So it'll be available to you to watch for anybody you know who didn't get to see it tonight. And with that, thank you very much. Good night, everybody.
All right. Thank you, everyone.
Gracias.
Gracias.